In this lesson, we'll continue our discussion of the systemic circulatory system by looking at the blood supply of the abdominal cavity. So let's start with the aorta. Just to review, we know that the aorta ascends from the heart. The heart would be like right about here, right? From the left ventricle, we have the ascending aorta here, the arch of the aorta here. Then this whole big thing, this whole blood vessel going down is going to be the descending aorta. Now, we know from a previous lesson that the descending aorta is broken up into two parts. Above the diaphragm, this muscle here, this is known as the thoracic aorta. And then below the diaphragm, this is going to be called the abdominal aorta. Right? So the abdominal aorta basically extends from the diaphragm roughly to about like L4, L5. That's about where it ends. Okay, so this is going to be the focus of our lesson today. Here's a little bit more of a blow up, right, where we just see the abdominal aorta. Now, I like this picture here. Check this out on the left. 1, 2, 3, 4. These four blood vessels come off of the aorta. However, they're not paired. If you notice, they all come off the front of the aorta. Here, here, here. And this one actually comes off the bottom. But they're not paired. Whereas these 1, 2, 3, 4, 5, these are actually paired. They come off on the left and the right sides. Right? For instance, we have two adrenal glands, two renal kidneys, which get the renal arteries. So they're going to be bilateral. So here they're showing you the paired branches off the abdominal aorta. I like the way they do that. So let's go to the notes now. So we said before that the abdominal aorta is basically the descending aorta below the diaphragm. The first blood vessel I want to show you coming off the abdominal aorta is known as the inferior phrenic artery. So take a look up here, the very first branch, one going to the left, and then right here going to the right, that right there, right at my cursor. That's the inferior phrenic artery, and basically it's supplying blood to the diaphragm. Let's see if you remember this. The last branch off the thoracic aorta was this little blood vessel right there and on this side. That's the superior phrenic artery. So it turns out the diaphragm actually has dual blood supply. It's getting blood from above the superior phrenic artery, and then on the underside it's getting from the inferior phrenic artery. Now, the next three blood vessels I want to do together. So in your notes, do me a favor, highlight celiac trunk, highlight superior mesenteric artery, and then highlight inferior mesenteric artery. We're going to do those three together. Watch this. So these three blood vessels, if you've ever watched the TV show CSI, or you're kind of familiar with the police department, they have a crime scene investigation unit, you're going to remember these three blood vessels as C, S, I. Celiac trunk is this network of blood vessels here. The second one down, superior mesenteric artery. And then the third one down, inferior mesenteric. Notice these three blood vessels don't come off the sides of the aorta, they come off the front, right? They're anterior blood vessels. So on a model, they're pretty easy to find. Let's take a look at the celiac trunk. So we know from previous lessons that a trunk means that a blood vessel is going to divide. And it turns out the celiac trunk has three branches that I'd like you to be able to find. The first one is the common hepatic artery. So first of all, hepatic means liver, right? And we know that the liver is on the right hand side. So this is going to be the blood vessel that's going to head over to the right to supply structures around the liver. The smallest branch and heading to the left, because it's going to go to the stomach, is the left gastric artery. This is the smallest of the three branches, and it's going to head over to that lesser curvature of the stomach, right, where there's two curvatures, the lesser curvature and the greater curvature. This is the one on top, and basically this artery is supplying blood to the stomach and to the esophagus. The biggest branch, you can't miss it when you see it, is going to be the splenic artery. This is going to head obviously towards the spleen, and we see it running on top of the pancreas. So just to kind of show you here a little bit, this would be the hepatic, common hepatic. This big guy here going to the left would be the splenic, and the little one there just above my black line is going to be the left gastric. This is the superior mesenteric. Now the superior mesenteric supplies blood to all of the small intestine and the beginning part of the colon, like the cecum, the ascending colon, the appendix, probably about half of the transverse colon, and then the pancreas. This blood vessel here, oh, let me go back to this one over here. This blood vessel here is the inferior mesenteric. This is going to do the rest of the colon, descending colon, the rest of the transverse colon, the sigmoid colon, the rectum, that type of thing, right? So the inferior mesenteric artery does the last 1/3 of the large intestine, right? That includes the half of the transverse colon that the superior mesenteric artery didn't do, the descending colon on the left, the sigmoid colon, and the rectum. So let me show you a little bit more of a detailed picture. It's a little bit advanced, but here we see the C, S, and then if we go down, I, right? C, S right there, and then I. So let's take a look at the branches of the celiac trunk because we're seeing the whole blood vessel now. All right, so the one going to the right is going to be the common hepatic. The one, smallest one going to the stomach, here's the lesser curvature of the stomach. This is the left gastric. And then the big one here is going to be the splenic. It goes down, it runs on top of the pancreas like this, and then look at this, it ends over at the spleen, hence the name the splenic artery. Here's the superior mesenteric artery. So if you follow this, this is kind of heading over to the right where it's going to do all of the intestines. This represents all of the intestines. Here's your cecum, appendix, ascending colon, and probably half of the transverse colon. That's going to be all superior mesenteric artery. And then here's our eye right there. Inferior mesenteric artery is going to do the remaining part of the transverse colon, the descending colon. Here's your sigmoid, and then it's going to go right to the rectum. Okay, so that's our CSI. The adrenal arteries are nice and easy. You're going to find them going to the adrenal glands. The renal arteries are going to go to the kidneys, right? So you'll have a left and right adrenal and a left and right renal, right? So we kind of come over here. Let's say, what's an easy picture? Let's go to, yeah, let's go right here. So I labeled them for you. I only did it on one side, but here's the adrenal gland on the right, adrenal artery on the right, and then this would be the adrenal artery on the left. I didn't want to over label it, so I just only did one side. Here's your renal artery here, going to the left, renal artery going to the right. Okay, adrenal and renal. The next one we want to look at are what we call the gonadal arteries. Now, if we don't know the sex, let's say of a model, a torso that we're looking at, you can call them the gonadal arteries. You could call them uh, uh, yeah, probably gonadal is the most generic term I could think of. But if we know that the model that we're looking at is a female, we would call them then the ovarian arteries. If we know the model is a male, they would be known as the testicular arteries. So watch this. These come off kind of interesting. I always look for this. They kind of come out oblique, like at an angle this way, right? So this one will go this way, this one will go a little bit out this way. They don't come out straight to the sides. They come down at an angle, and that makes them easy to find on most models. All right, so these would be the gonadal arteries. And again, if we know that the sex, in the female it would be the ovarian artery, in the male they would be the testicular arteries, and we'll follow them down when we get to the reproductive system later in the semester. Okay, so let's make sure we got everything in the notes. All right, so the adrenals, the renals, right, they go to the kidney, adrenals go to the adrenal glands, and then the gonadals are going to go to either the ovary or the testicles. The final arteries that come off of the aorta, the lumbar aorta, are the lumbar arteries. Now, let's talk about where they go first. These are basically going to supply the vertebrae, the spinal cord, the meninges, the skin of the lumbar area, and even the abdominal wall. And then let's show you right here. These kind of come out laterally from the aorta. So you'll see one lumbar artery here. Here's another lumbar artery there. That one right there. That one right there. That one there. That one there. They kind of remind me of intercostal arteries that coming off the thoracic aorta. They just kind of come out laterally, so they're easy to find. Okay, so those are the lumbar arteries. Before I go back to the note, this one coming down right to the middle of the sacrum, great name, median sacral artery. Right, that's going to be this one here, and that's supplying the structures of the sacrum and the coccyx. And you should be able to find that pretty easy also. Now, about the level of L4, L5, the aorta is going to stop, it's going to end, and it's going to divide into two large blood vessels known as the common iliac arteries. Okay, so we can see here I labeled them. This about the level of L4, L5. This would be the right common iliac, right to there, and then the left common iliac right to there. Right, we're going to see that these are major feeds of blood to the pelvic organs here, and even to the into the lower limbs. Okay, so those are the arteries of the abdomen that we want to look at. The next thing we want to look at is the veins, or are the veins of the abdomen. This first one here is a big one. This thing is huge. This is known as the inferior vena cava. So let's take a look at how it's formed and where it runs, and then I'll show you a picture. All right, the two common iliac veins. Now I know we haven't looked at them, but you can probably guess they're right next to the iliac arteries here, right? These are the common iliac arteries, right? They're going to be right next to it there, the common iliac veins. We're just not seeing it on this picture. They unite to form this massive blood vessel known as the inferior vena cava. This now runs up through the abdominal cavity and the lower thoracic cavity, and it enters the right atrium, kind of like the bottom of the right atrium. We're going to find it just to the right of the vertebral column. That's going to be slightly anterior and to the right of the vertebral column. The aorta will be on the left of the vertebral column. So those two blood vessels run side by side. And it turns out that most of the blood from the major abdominal organs, right? Viscera means organ, is going to drain into the inferior vena cava before returning to the heart. So this is really a major blood vessel that's bringing blood out of the abdominal cavity back to the heart. So here's a good picture. Now we're seeing the common iliac veins, right? We're not seeing the arteries this time. We're seeing the common iliac veins. And then look what they do. They unite. And then there it is. It's just huge, big blood vessel here. That's your inferior vena cava. All right, here's another picture. Two common iliac veins right there. And then here now we're seeing the whole inferior vena cava going up right into the bottom of the right atrium. Okay, so let's take a look at some of the major blood vessels that drain into the inferior vena cava. The first one are the lumbar veins. So if you remember from a couple minutes ago, we saw the lumbar arteries. These are the lumbar veins that are just running next to the lumbar arteries, right? So those are going to be nice and easy. Excuse me, you can see those right here, right? So they kind of run right next to the arteries. Here's one over here. So those are the lumbar arteries. Now, the gonadal veins. While we're on this picture, watch this. The right gonadal vein goes directly into the inferior vena cava. But notice, guys, the left gonadal veins here don't, like if this is the blood vessel here, notice it doesn't cross over and enter the inferior vena cava. The reason for that is the aorta is running right here. So those blood vessels can't get to the side of the inferior vena cava. So watch what happens. The gonadal veins on the left have a little bit of a different plumbing. They're going to go up into the renal vein on the left. Now the blood will head over this way. This big vein here actually crosses on top of the aorta. You'll see that on the models that we cover. So this is kind of a unique situation where the left and the right are not the same, right? The right gonadal vein goes right into the inferior vena cava on the side of it there on the right. The left gonadal vein, check it out, does not. It goes into the left renal vein. And just to kind of give you a little bit more advanced information, the right adrenal vein goes into the side of the inferior vena cava, but look at the right excuse me, the left adrenal vein. It doesn't. It also goes into the left renal vein. And again, the reason for that is this aorta is going to be running right over here. So these blood vessels can't get to the side of the inferior vena cava. Here's another one. Inferior phrenic vein on the right goes right into the inferior vena cava. Inferior phrenic vein on the left goes also into the left renal vein over here. All right, so the left side on these blood vessels is a little bit different than the right side. Okay, so the gonadal veins, right? So these drain basically the ovaries and the testes, and this is what I was talking about on the picture. The left ovarian vein and the left testicular vein, they don't go directly into the inferior vena cava. Instead, they drain into the left renal vein. The right ovarian or the right testicular vein, they drain directly into the right side of the inferior vena cava. Okay, so that's an important anatomical difference, right? For surgery purposes, for diagnostic imaging purposes, right? We need to know that. The two renal veins, all right, so they basically drain the kidney. And as I mentioned before, this left one is much longer and it actually crosses over the aorta. And basically, it's receiving the blood from the, again, the gonadals, right, ovarian or testicular, the left inferior phrenic, and the left renal vein, just as we saw before. Look at the size of this thing. Yeah, big blood vessel, you can't miss it. So this would be the left renal vein. Here's the right renal vein. Let's see if I have it labeled for you. Yep, right here. So here's your renal vein here and there. Okay, and then again, some of the other veins, the hepatic veins are draining the liver. The adrenal veins are draining the adrenals, obviously. So those were some other ones there. Oh, okay, so the adrenal veins, the phrenic veins, and the hepatic veins, we kind of got those. Again, adrenal veins draining the adrenal glands, the phrenic veins draining the diaphragm. Whenever you hear phrenic, think diaphragm, and then hepatic veins obviously are going to drain the blood coming from the liver. Okay, the last thing I want to discuss on this lesson is something known as the hepatic portal system. I want you to think about this for a minute, right? You may have had, breakfast, lunch, or dinner a couple hours ago. And right about now, you're probably absorbing some of those nutrients from the foods that you ate. However, you may be also absorbing chemicals or toxins or poisons that could kill you. So, what we have to do is we have to take the blood from the GI tract, and instead of that blood with nutrients and also toxins just going into our general circulation, we need to send that blood to the liver. First, the liver processes that blood from the GI tract. It's going to process that blood, and then the liver will put the blood into the general circulation. If we didn't have this situation, right, this blood going to the liver first, right, we would have died a long time ago. So the system that's going to bring the blood from the GI organs to the liver is known as the hepatic portal system. So let me read this sentence here and then I'll show you a picture. It's probably easier to see on the picture. Venous blood from the gastrointestinal organs and the spleen goes first to the liver before returning to the heart. So we're just saying we got to have that blood from the GI tract go to the liver, and then the liver will put it into the general circulation. This gives the liver first crack at the nutrient-rich blood, but also toxin-rich blood, right? The liver is going to make sure there's enough glucose, enough amino acids, enough fatty acids, and then it's going to send the blood out into the general circulation. Okay, so watch this. I'm going to skip over this a moment just to show you. So in our book here, this represents the small intestine, right? This is not showing all the small intestine, right? So all of a lot of the absorption of nutrients and toxins is going to come from the small intestine here, and the blood is going to go into this vein here. We have blood also being absorbed from the colon over here, the ascending colon, from the spleen, all the abdominal organs. Notice, guys, all these veins here, this is the splenic vein, inferior mesenteric vein, superior mesenteric vein, all of them become this big vein right here. This is the one that I want you to know. This big vein takes all that blood and look where it's bringing it to, the liver. This is known as the hepatic portal vein. Okay, and you're going to see People that have like cirrhosis or alcoholism or severe chronic hepatitis can get scar tissue in their liver, and now that causes the blood to back up here and even back up into these veins. This is known as portal hypertension, right? It actually causes high blood pressure here, and that causes a whole bunch of other problems where people get like hemorrhoidal veins in their esophagus and they can burst, and that can be fatal. You'll learn something called esophageal varices. So there's a lot of clinical ramifications that take place here. So this blood vessel, this is the one I want you to know, is called the hepatic portal vein. And again, it's receiving blood from all these veins here. And instead of this blood just going into the general circulation, that blood is being shunted to the liver. The liver processes the blood, and then the liver will do this. See these little hepatic veins right here? Then the blood will leave the hepatic veins and then go into the inferior vena cava. So um, it's important that you don't just call this the hepatic vein, because that's these up over here. That would be incorrect. This is the hepatic portal vein, right? So that's an important distinction. Okay, so the hepatic portal vein, again, this is the largest vessel of the hepatic portal system. It's basically receiving blood from the inferior mesenteric vein, the superior mesenteric vein. This is the big one. Splenic vein, gastric vein, cystic vein is actually coming from the gallbladder. And then all that blood from all these veins here, it's all going to be directed through this big guy right there. That's the one I need you to know, the hepatic portal vein. And now the liver receives that blood and it processes that blood. Okay, so that concludes the lesson on the blood vessels of the abdomen. Again, we reviewed all of the blood vessels that come off of the abdominal aorta, and then we took a look at the blood vessels that fed into the inferior vena cava, which is this large vein going through the abdomen.